Hello and welcome to the fifth module of the IBE Health Diplomacy series. My name is Mary Secco and I am the Chair of Global Advocacy for the International Bureau for Epilepsy. It is my distinct honor to be able to walk you through this e-learning module, which was developed to help you to leverage tools to support IGAP implementation. This is the fifth module in the Health Diplomacy series. It builds directly on the information from Module 4, Leveraging IGAP for Action on Epilepsy. The learning objectives for this Health Diplomacy module are to identify tools that can be used to leverage the WHO Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, also known as the IGAP. It's also to demonstrate the use of tools to develop an advocacy action plan and to identify the benefits of developing partnerships and networks for IGAP implementation. IBE has developed a two-page practical guide to unpack the World Health Organization's Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. It can be downloaded from the IBE website. The IGAP is important because it is the first ever global action plan on epilepsy. It includes epilepsy-specific objectives and speaks directly to the mission, needs, and aspirations of the global epilepsy community. In this module, we will demonstrate the use of different tools that can be used to develop a community or country-level plan of action for IGAP implementation. Digital diplomacy is an effective tool. It's really the electronic media that we can use, for instance, websites, podcasts, blogs, or social media, to publicize our position to a broader audience and to influence negotiations. Digital diplomacy is an effective tool for both state and non-state actors to use to persuade or even pressure others into adopting a particular position in negotiations. It has been used to move topics to the top of the global health agenda. AIDS, non-communicable diseases, One Health, and universal health coverage have all used this digital diplomacy effectively. So civil society can use Twitter diplomacy to keep their priorities on the agenda. And this is used also by heads of state and government who use social media for public diplomacy and for outreach purposes. And some will rely on Twitter diplomacy not only to position themselves with their electorate, but also to secure an international audience and be able to move agendas forward. Social media needs to be factored in as a potentially critical new element in both diplomacy and policymaking. So IBE is proposing a cascade target to measure IGAP implementation. And if you'd like to learn more about this cascade model, you can go to Module 4 of the Health Diplomacy series. In review, what the cascade model suggests is that success will be achieved when 100% of people with epilepsy experience an improvement in their quality of life. Success will be achieved when 90% of all people with epilepsy are aware of their diagnosis as a treatable brain disorder. And when 80% of people with epilepsy have access to appropriate, affordable, and safe anti-seizure medicines, and when 70% of people with epilepsy are on treatment to achieve adequate seizure control. So earlier on we talked about this being about introducing you to different tools. So IBE has developed two toolkits, and one of the toolkits is the Advocates Toolkit for Making Epilepsy a Priority in Africa. And this toolkit can be used to plan your advocacy, it can be used to take action, and it can be used to expand your reach. And although this toolkit was developed by people in the African region, the strategies and templates in this toolkit are relevant for use in every community around the world. The toolkit can be found on the IBE website under the Global Advocacy tabs. One example of a template from the toolkit is the problem tree. A problem tree is a visualization of the main problem and its causes and effects. This tool allows you to see the problem more clearly, to break it down into more manageable chunks, and to identify targets and clarify objectives. The real benefit of the problem tree is the discussion and debate that it helps to facilitate with you and your colleagues about the root causes of the problem. Prior to developing an advocacy plan, it is important to analyze your situation or local context. You have an idea about what you want to do, but have you looked at the external factors that may be out of your control? Which of these factors, political, economic, social, technological, legal, or environmental, could you harness for your purposes? Looking at the big picture will help you plan practical and achievable results. So again, when you go to the Advocates Toolkit on pages 18 and 19, you will see examples of a pestle analysis. Once you have an idea about what you want to do, it is important to make sure your objectives are SMART. Are they specific, measurable, attainable, relevant, and time-bound? In general, having 2 to 4 objectives will help keep your advocacy program manageable. It is also good to use action words when you develop your plan. So to develop, or to create, or to promote, or to establish. It is important to write out your plan, breaking it into activities, results, objectives, and an overarching goal. Here are 2 templates from the Advocates Toolkit that you can use. So once your plan is in a simple to review format, it is useful to take a step back and assess whether you're happy with it. Will it contribute to achieving your goal? Is it realistic and achievable? It is also important to list the resources that you will need to execute your plan, as this can help you to measure available human and financial resources. It is also important to do a stakeholder analysis of what people can help you to implement your plan. It's important to understand who your stakeholders are, and one way to identify your stakeholders and their impact is using this tool, which can be found on page 23 of the Advocates Toolkit. It is a stakeholder assessment to determine who are you going to work with and who will you work around. So generally you have 2 types of stakeholders: decision makers and influencers. Decision makers can change a law or a practice, they can allocate a budget, or decide where public attention is focused. Influencers can help you reach the decision makers and convince them to make the change you want to see. This chart shows an example of the level of support and power of each of your main stakeholders. For example, a local Ministry of Health official might be powerful but not supportive, whereas people with epilepsy might be supportive but not powerful acting alone. The arrows within the diagram show where different actors might be able to influence others to create larger impact. IBE has also developed an Advocates Toolkit specifically for reducing epilepsy stigma. Again, the toolkit was developed for use in Africa, but the templates and the guidance within the toolkit is relevant for regions around the world. To achieve IGAP Strategic Objective 5, which is to strengthen the public health approach to epilepsy, you may want to target stigma, because stigma is a significant contributor to poor physical, mental, and social health for people with epilepsy. To reduce stigma, you will need to develop a multi-pronged approach with multiple messages to different audiences in different sectors. On the right are the 6 steps that are recommended in the Advocates Toolkit for reducing epilepsy stigma in Africa for chapters to develop a stigma intervention. These steps are described in detail in this second toolkit. I think too often IBE chapter personnel work alone, and what the big message is that health is everyone's business. And by partnering with organizations or networks, your chapter will have a larger reach and can help get your specific epilepsy messages heard. Can you work together and incorporate your messaging into their communications? Do you actively network, build on your connections, collaborate for research, or share information such as newsletters, reports, or advocacy materials? There are so many organizations working on improving the lives of people with epilepsy across the globe. There are other IBE chapters you could partner with, the ILAE, the World Federation of Neurology, One Neurology. Both the regional offices of the WHO and the Brain Health Unit at the WHO in Geneva are very interested in seeing IGAP implementation. Many member states have indicated that this is a priority. There are disability groups, foundations, and UN agencies. So the message here is that health is everyone's business, and partnering and collaborating will help raise the voice for people with epilepsy globally. So here are some practical ways you can expand your reach through partnerships. You can create national networks or engage in existing networks around healthcare to raise your issue. You can draft joint letters to decision makers and share them with the media or on social media. You can release joint press statements around important dates or before conferences, or you could collect signatures to support a specific request to the government. Investing in relationships can make a huge difference, and persons with epilepsy themselves may often be the most powerful and persuasive advocates and messengers to expand your reach. There are many benefits to networking: sharing of information or best practices, increasing your connections, learning from others' experiences to make your own organization stronger, building a sense of community, a sense of momentum, and amplifying your voice through the partnership to get the issues heard on a wider stage. There's also an opportunity for you to build relationships with policymakers. So when you do this, think about the people you are talking with. What are their job titles and priorities? Find the real decision makers. Who has been responsible for the latest budget? Has anyone developed an action plan or strategy? Do you share a common interest that could be mutually beneficial? A long-term positive relationship with government departments is likely to yield results as well as useful collaborative partnerships. Decision makers are often very busy and they have to deal with multiple items on their agenda. So it is really critical that you come up with solutions. Bring them a solution that aligns with their priority areas, that is realistic and implementable. So our role as advocates for people with epilepsy is to help government to generate positive reports to international bodies on their implementation of political commitments like the IGAP. If you can do this, you will build trust and social capital with these key actors. In December 2022, the WHO published an epilepsy technical brief called Improving the Lives of People with Epilepsy. The technical brief is intended for a broad range of stakeholders. It is intended for governments, policymakers, and program managers in ministries of health, in ministries of social protection, in ministries of education, people engaged in human rights and other sectors at the local and national levels. It has been designed and developed to help to restructure and strengthen their approach and services for people with epilepsy. In the Improving Lives of People with Epilepsy, there are 11 levers for change. These levers for change all contain corresponding actions which are useful in planning and programming for civil society groups, for professional associations, academic institutions, and organizations of people with epilepsy and their families. They're also important for use by development partners and global and national funding initiatives. So for demonstration purposes, we will highlight the levers that are identified below in red, but we do recommend that you download a copy of the WHO technical brief on the IBE website and read through all of the levers. This lever, political commitment and leadership, addresses the political engagement of decision makers and other stakeholders to raise the profile of epilepsy prevention, treatment, and care. This lever reinforces the need for training epilepsy champions to work with political leaders and governments. For each of the 11 levers for change, there are suggested implementers and recommendations to generate commitments at the policy level and how to operationalize this lever. There are also supporting resources or recommendations for further reading. This is an example of another lever from the technical brief, in this case, governance and policy frameworks. Under this lever, policy frameworks are considered for all systems and all sectors for a holistic approach to addressing epilepsy. The approach emphasizes coordinated action and respect for human rights. This lever also reinforces the importance of policy-level engagement with a broad range of government stakeholders that go beyond health, especially those engaged in civil affairs, education, labor, and with organizations of peoples with disabilities. Budgets are where policymakers and politicians reveal their true agenda and true priorities, regardless of promises, speeches, and announcements. So action will happen with increased resource allocation, making budget advocacy an essential tool and crucial tactic. For this lever, the implementers are policymakers, mostly from ministries of finance and also health promotion managers and planners. But organizations of people with epilepsy, philanthropic foundations, and the private sector are also influential in funding and allocating resources for people with epilepsy. The intention of this lever is to ensure engagement of a wide range of stakeholders. At the operational level, this lever recommends that you carry out stakeholder and relationship mapping of key individuals who can help in epilepsy advocacy, diagnosis, treatment, research, and support, and to understand their needs and preferences and plan activities for engagement and empowerment. This lever recognizes the importance of models of quality, person-centered care for epilepsy in all sectors. The list of implementers in this lever includes service planners, health managers, managers in the education sector, employers, organizations of people with epilepsy, academics, etc. Models of care should be attentive to the different needs of subgroups of people with epilepsy, and they should address the comorbidities that oftentimes burden people with epilepsy. This lever addresses monitoring and evaluation of epilepsy services and care in robust health information systems for collecting, generating, and analyzing reliable data to improve decisions. The IGAP has specific measurable targets. You can plan your advocacy around these targets. A tool is to develop a report showing baseline data and progress to date. You can post the progress on your website. You can share it in social media. You can identify a small group of decision makers and work with this group to influence their actions, their votes, their decisions, their policy statements. You can look at the commitments your local or national government has made that you could monitor. Have you conducted a survey or interviews to generate data to demonstrate your progress? How could this help you to achieve your goal? Whatever you do, it's critical that monitoring and evaluation is done so that you can keep policymakers and others accountable to IGAP implementation. So the learning outcomes for this module were to identify tools that can be used to leverage the WHO IGAP and to demonstrate the use of these tools for you to develop an advocacy action plan, and also to identify the benefits of developing and establishing partnerships and networks. So the key takeaways from this module. Number one, IGAP adoption does not equal IGAP implementation. We must now put words into actions to achieve our goals. Civil society can use Twitter and digital diplomacy to keep their priorities on the agenda. IBE has developed two toolkits, an advocate's toolkit and an advocate's toolkit for reducing epilepsy stigma. Both of these toolkits have templates for helping you to plan your advocacy and to expand your reach. Health is everyone's business, so seek partnerships and join networks. and invest in relationships with policymakers. Read the WHO technical brief and understand the 11 levers for change. Each of these levers includes implementers, which are the people to help get the job done, and recommended actions at the policy and operational level. And monitor and evaluate. The IGAP has specific and measurable targets. Plan your advocacy around measuring changes in these targets. This is a list of the tools that we've mentioned in this module. The IGAP Unpacked, the Advocates Toolkit, the Stigma Reduction Toolkit, the WHO Epilepsy Technical Brief, and the IBE editorial on IGAP. All of these tools can also be found on the global advocacy pages of the IBE website.